So let's go ahead and finish up this chapter. We're almost there. We are. And a lot of this chapter is review from even chapter 41. So if you're reading your chapter, you're noticing that we're going over the same things. And it kind of is just a continuation, like really making sure that you understand the information before we keep going. So just a couple of things just to close up with. Pelvic floor muscles, I know in some of our flip discussions, we had said those are really hard to memorize. And I know there's a lot of definition of different floor muscles that you want to know from your note cards, and those are good to know. However, we're not going to spend a lot of time on those because there's just so much more that's more important to cover. But I do want to let you know that one of the pelvic floor muscles that we do see transabdominally is the levator ani muscle. And we see this when we are doing a uterine scan, and it's just good to be aware of them because they are not masses. Let me see if I can get, there they are. They are on each side of the uterus here in the lower uterine segment, so by the cervix. And those are your pelvic floor muscles that are kind of holding up that uterus there in the bladder. So if you see symmetrical, bilateral, hypoechoic circle masses, that's what is going on there. The pelvis, of course, has a lot of vascularity because of what kind of organ it is and that it's used for reproduction. So, of course, we're going to have a lot of vessels going towards the uterus and the ovaries. Just basically that this is just a look at the pelvic vascularity. A lot of the vascularity comes from the iliac artery, and it branches off from there, the internal iliac. And so you're going to have the uterine artery is a huge one that's going to be feeding the uterus. That's something that we're going to concentrate on. The vaginal artery is another vessel that feeds the vaginal canal. And there's an ovarian artery. There are 4 different arteries that go into the uterus, and those are the ones I want you to know for this chapter. There's arcuate vessels that we are going to see when we do an ultrasound. Like here's your little uterus. On the periphery, like around here, there's going to be all these vessels. So when you put color Doppler on, they're going to light up. And those are called the arcuate arteries. And then from there, there's going to be the radial arteries, and they're kind of coming in from the arcuate. So they're branches of the arcuate arteries. This is what it looks like when you put, this is normal color flow of the uterus. You can see how much vascular flow there is in the uterus. And it makes sense, right? We need a lot of vascular flow to get to the baby if you are pregnant, the baby. And so there needs to be a lot. Here's a better picture than my drawing. So here's the uterine artery. So that's the first one. And then the arcuate artery. And then the radial arteries kind of go into the endometrium here. So that's what I want you to know is basically the arcuate arteries and the radial arteries. There's also straight and spiral arteries that those are these that are going into the endometrium that shed. Those are the part that bleed. The endometrium needs a lot of blood because that's where if there is a zygote, that is where it's going to implant. And so there needs to be a lot of different branches to support that little baby if it implants in there. So I would say if I was looking at this, I would go from uterine artery to arcuate to radial to straight and spiral. So those two are going to be in the endometrium, and the radial and the arcuate are going to be more in the myometrium. So I wanted to quiz you a little bit on your endometrial phases. This is a what kind of scan? Transabdominal or transvaginal? What do you think? And what phase do you feel like this is? Let's say this measure is about 0.2 centimeters. What phase would that be? And also interesting little note is you can see these little black dots here. Those aren't cysts or anything. Those are arcuate arteries. So if you put color flow on it, this would all light up. This is all vascular flow around the uterus. Okay, this is our next phase. Let's see, this measurement probably is about 0.7. What phase do you feel like that is? And we're going to continue into this phase here. And obviously you can see it's a thicker endometrium, more echogenic. What phase would this be? A little note about fallopian tubes, and I'm kind of like piecemealing everything that I wanted to talk about in because there's so much. But normal fallopian tubes are difficult to see transvaginally and transabdominally. The only time that you're going to see fallopian tubes is if there's fluid or like a hydrosalpinx or a pyosalpinx where there's fluid or pus that is in the tube. Other than that, you're just not going to see the fallopian tubes. They're too tiny. Wanted to also show you this as we wrap up. We're getting close, but I wanted to show you these little areas here. And this is an ovary. And all of these little black circles, those are follicles. And so those are normal to see in a person that has not yet gone into menopause. And it actually is a good sign that there's still a high ovarian reserve. Here is a transabdominal, and you can see the same ovary here, but look how much better it looks here. It's just such a crazy look because you don't have to go through all of this space, you know, to get to it. It's just right there, that close. Again, a review, this is a long, that was a horrible line, but this is a sagittal image. So let's put our brains on about a transvaginal ultrasound. And the orientation is a little bit different. So this is going to be anterior. This is going to be towards the feet or caudal. This is going to be posterior. And this is going to be cranial. So it's basically like someone is laying on their head like that. It's crazy. I usually, as you get used to it and you don't think too much into it, it becomes easier. But if you like go down deep diving into like orientation here, it's going to be really difficult for you. So I would say just remember anterior and posterior, caudal and cranial, and it'll get easier as the more you scan. Again, with the ovaries, we're going to want to measure the same thing that we do with uterus, and length. Thickness means it's like an anterior posterior measurement, and width. So you're going to measure, this is a long view of the ovary, You're gonna measure here, here, and then let's say this is a transverse view, you're gonna measure here. The posterior cul-de-sac is one of the last things we're going to talk about. And this is the recto-uterine recess. It's the most posterior inferior reflection of the peritoneal cavity. So it's located between the rectum and the vagina. It's also known as the pouch of Douglas. And the posterior cul-de-sac is where you're going to see some collection of fluid, especially during ovulation, or if a patient has had kind of cysts, sometimes right in their menstrual cycle. So it's not uncommon to see fluid there. And you just want to know what it is. So here is a transabdominal ultrasound of a long uterus here. You can measure like that. And right below it, you can see this black anechoic area there, and that is fluid. One of the main things that we kind of have trouble with is gas and fluid-filled bowel, and you're going to notice that throughout all of your scans, except for probably vascular, but any kind of abdomen, pelvis, you know, there's bowel there. And ultrasound, that's like ultrasound's Achilles heel. It's really difficult for us to go through a gas and fluid-filled bowel. We just cannot see through bowel. So it's going to be like a poorly defined echo-free mobile structure, and it's really difficult sometimes, and it takes a lot of looking to be able to distinguish, is this a mass or is this bowel? So we're constantly looking for peristalsis, and that's movement of the bowel, to rule that out. Because of course, like if it was some kind of ovarian mass, it would not move, correct? And so we palpate and we push and we try to see if it moves, and if it does, that rules out that. So all this nastiness, this is all bowel. So it's like a dirty shadow. Of course, we all have it. We have to have it, you know, but it kind of gets in the way of when we're trying to find our ovaries. And there's been a lot of times that I've had to say, not well seen due to bowel gas. So it's just part of the ultrasound life. There is a procedure that you can do called a sonohysterography or a saline infused sonography. And it's where a doctor will put fluid inside the endometrial canal, and it kind of blows up the canal with fluid so that you can see the inner lining of the endometrium and look for polyps or like a mass or like septations or something that's causing the patient not to be able to conceive. This is what the endometrium looks like when it's full of fluid. It just looks like anechoic, remember, because anechoic is fluid. Basically, it's simple fluid. And so if there was some kind of polyp or something, it would be kind of on the edge there. And it'd be easier to see. 3D ultrasound, we can also do transvaginally, and I love my 3D probe that I have at the place that I work sometimes, because it can allow me to see IUDs if they're in the correct space, if there's a polyp, where it is, what it looks like, kind of just another view. And so this is what it looks like. This is a coronal view. This is the whole endometrium. So this is if you cut it coronally. And if they had an IUD, you would see it in the middle here, and we'll talk about those later on. But it's just a good way to visualize the endometrium in a different way. These are the different scan planes. So this is a coronal scan plane, this is a transverse, and then this is a sagittal, and then this is the 3D image right there. Alrighty, that's it. Have a great day.